So welcome this evening, members and partners of Doctors for Change. We're very excited to be having another forum to talk about COVID vaccination rollout in Texas. So we're going to get started in just a minute. We'll let a couple more people log in, and then I'm going to introduce our speaker tonight, and then we'll follow that with Q&A, and then a discussion about ways we can address barriers. So for those that may be joining us and don't know who I am, I'm Ariana Quinones. I'm the Executive Director of Doctors for Change. And with me this evening, I have Allison Winicky. She's the President and CEO of the Immunization Partnership. I'm going to introduce a little bit about her. She's an incredibly accomplished individual. She serves as well as being the CEO of the Immunization Partnership. She serves as an adjunct professor for the University of Texas Health Science Center at the Hastings School of Public Health. She has her Bachelor of Arts in Political Science and Health Policy from Rice University and her JD from Georgetown University Law Center. Something of interest is that she's published 2 books on emergency preparedness laws, Control Measures and Public Health Emergencies, a Texas bench book, and Preparing for a Pandemic, an Emergency Response bench book and operational guidebook for state court judges and administrators. It's very timely given the fact that we have been living in a pandemic for a little over a year now. Now that I know that you published 2 books, I'm going to have to go to the library and look those up. So welcome, Allison. Thank you so much for being here tonight. Allison is going to share with us what the Texas Immunization Partnership has witnessed in relation to COVID vaccine rollout and things that have been working and things that haven't been working. And we look forward to your presentation. Thank you.
Well, thank you so much, Ariana. I really appreciate it. Appreciate being invited to come and speak speak with your members as well. And so I'm going to try to share. I have some slides here, and hopefully you guys can see them.
Yes, thank you.
Okay, perfect. All right, so as she mentioned, I'm going to talk a little bit about what at the Immunization Partnership we have been seeing in relationship to the COVID-19 vaccine rollout. I am a lawyer, as Ariana mentioned, so I always have my disclosure and disclaimer that this presentation is for educational use only and does not constitute legal advice. I recommend public health lawyers like myself because we are pretty handy to have around and have a lot of really good information to share. A little bit about my organization, if you are unfamiliar. So we are the Immunization Partnership. We are the only organization in Texas focused on pro-immunization issues, and our vision is a community free of vaccine preventable diseases. And we work through our mission to eradicate vaccine preventable diseases by educating the community, advocating for evidence-based public policy, and supporting immunization best practices. And our motto is immunize, prevent what's preventable, which I think is always useful. Since I know this is a Houston-based organization, I wanted to share with you guys, I also live in the area in Galveston County, and I always love going to Mardi Gras. It's something that I've done for many years. And this is an image of what our second pandemic Mardi Gras looked like down in Galveston. You can see on 25th Street, that's the parade route. The streets are empty, but the houses are still decorated. And so I, like everyone else, is looking forward to getting out of this pandemic as quickly as we can. And hopefully together we can, make that change that can really push us over the finish line. So I wanted to start off talking about some late breaking information that has just come across related to COVID-19 vaccines, which I thought would be interesting to you. And so information that has just come across the wire is that starting on Monday, March 29th, all Texans age 16 and older will be eligible to receive COVID-19 vaccination. And on my slide here, I kind of go through the entire timeline. So when you go back to December 14th, that was our first opportunity where we had phase 1A, which was our healthcare providers, frontline healthcare providers, and folks, residents in nursing home and staff in nursing home. And then quickly after that, at the end of December, on December 28th, we opened it up to phase 1B. As you guys know, really looking at high risk people who had pre-existing conditions, and also those ages 65 and older. And, you know, supply and demand have really been the watchwords ever since we've gotten vaccines authorized for emergency use into the United States. And so we worked for a few months under the phase 1A and phase 1B high risk groups. And then on March 3rd, we opened it up in Texas, eligibility for school and child care center workers. And then very quickly after that, on March 15th, the state decided that there was enough supply coming in that we could open up to this phase 1C, which is basically folks over the age of 60, or over the age of 50, excuse me. And then, as I mentioned, coming up at the end of March, it is open to all Texans. And so that's a really, really big deal to get that, to get there so quickly. I do want to make the note, though, that even though we are opening up eligibility to basically everyone, that doesn't necessarily mean that we already have the supply available for everyone. President Biden did say that he hoped that we would have enough supply for everyone in the United States by May, and that eligibility would be opened up to everyone by May. And so we are getting there. We're moving in that direction, but the supply issue is definitely something that is still on the table at this time. The other late breaker that I wanted to share with you guys is that the Department of State Health Services is soon going to launch the Texas Public COVID-19 Vaccine Scheduler. And so this will be an online website that folks can use to help identify either state clinics or local health department clinics that are going to have vaccine availability, and a person can be notified when vaccine will be available. This is another big step. We have not had yet in Texas a statewide portal that folks can use to actually register and sign up for vaccines. And so this is something that I know a lot of folks have been asking for a long time, myself included, for many, many, many months. And so I'm glad to see that that is on the horizon and hopefully will be launched soon. So let's talk a little bit about the numbers, because we've just been talking COVID case numbers, now COVID vaccine numbers for a while. And so where are we today? So as of today, we have about 11% of Texans ages 16 and above who have been fully vaccinated against the coronavirus. And that's good, I guess, but it could be a lot better, because really at this point in time, Texas ranks 45th out of 50 states in the percentage of their population that has been fully vaccinated. And so Texas keeps slipping down the rankings in percentage being populated, which I think is probably one of the reasons we're opening up eligibility to meet that demand. But we also have to make sure that as the supply is adequate, that we continue to stoke that demand amongst Texans. You know, looking at the numbers, I always think that this is really, really important to share, because this global pandemic has been happening now for over a year, and it has truly been significant and devastating for so many people around the globe. I mean, we have globally, you know, over 2.7 million people have died. In the United States, we've had over 544,000 deaths. In Texas, we're getting close to 50,000 deaths. I mean, this is really, really significant. And I have concerns now that as we now have 3 vaccines authorized for emergency use, and we're starting to get folks fully vaccinated, that there is a little bit of complacency, but I don't think that we should take our foot off the gas at this point at all, because we really need to make sure that we can get everybody vaccinated, all 29 million Texans, and get out of this pandemic. So here, looking at some of the numbers, so this data comes from today, and you can kind of see, and this is for just the state of Texas, what we've been doing with cases. And so, yeah, good news, over the last 2 weeks, we have seen a 33% decline in COVID-19 cases in Texas. That's excellent. You know, even better with deaths. It's an almost 40% reduction in deaths. So this month of March, we've really been going in the right direction. But I also want to point out, you know, looking at this graph, you see it slowly goes up, a couple of peaks, but really about, you know, that huge surge in December, January, and then it was only really in February that we started to come down as we're getting more people vaccinated, but we still had a little dip back up in March. And so we really need to be vigilant about continuing our protective measures and making sure that we get everyone vaccinated. Risk level. So this is something that, again, I think is really helpful to know. Here in the greater Houston area, you can see on the map that most of nearly every county is considered high risk. And a few of the counties right around Houston are extremely high. And so, you know, Harris County, Galveston County, Brazoria County, Fort Bend, all of these are what they consider very high risk. And then, you know, looking up in Montgomery County and Waller County, those are extremely high. So again, even though you saw on the previous slide, the numbers are improving, we're definitely in, at least in the Houston area, under very high or extremely high risk for COVID-19 transmission and disease. So the name of the game, you know, with my organization, it's all about community immunity. It's really that concept that we need to get everyone vaccinated so that we can create this protective bubble so that we can block diseases from entering the community and then spreading amongst the residents. As we also know, you know, there are a few very small people who are unable to be vaccinated. They may have medical contraindications. You think maybe pediatric cancer patients or other people undergoing certain therapies that at this time they can't be vaccinated. And so it's really important that to protect them from disease, that we all get vaccinated. And so let's look at those numbers a little bit. And so this data came out late in the fall, and it estimated that if our vaccines in the United States were as effective as the original Pfizer and Moderna vaccines, about 95 to 94%, how many people do we have to get vaccinated to reach this herd immunity, to reach that community immunity level? And the estimates at that time, again, and that's with effectiveness rates that are extremely high, but it ranged from about 60% all the way up to 94%. And so that's a really, really high number. And then when you factor in that not all vaccines do have that high effectiveness rate, you know, in our Johnson & Johnson Janssen vaccine that was recently authorized for emergency use, you know, it's a little bit lower in the, you know, high 60s, low 70s rates, kind of depending upon what country you're looking at. You know, the lower the effectiveness rates for your vaccines, then again, the higher your vaccine coverage needs to be. And so we're continuing to push that number higher. And so it really could be that we're looking at, we need to get 90% or more of Texans vaccinated. Just as a comparison to other vaccines. So if we're looking at other adult vaccines, On this chart, you can see that for COVID-19, we're looking at the uptake. It could be, we might need to be up to 94%. Well, you compare that to the flu. In the 65 and older group in the US with the flu, they only have a 70% rate of getting their flu vaccine every year. Same thing with pneumococcal vaccine for 65 and older. It's only about 69% of people get it. And then the numbers just really drop off for adults for the rest. You know, flu ages 18 to 49, it's only 38% of Americans get their flu shot every year. And, you know, hepatitis B for 19 plus, it's about 26%. And then pneumococcal for high risk adults, it's only 25%. And those are people that it's recommended. And so we're talking about we need COVID-19 vaccination rates for adults to be much higher than any of the other adult vaccination rates that we already have. So it's a really, really big deal. And we have to do much better than we've done for any other of the other vaccines. So let's take a look at the state of Texas and how are we doing as a state. I mentioned that, you know, we've got about 11% of the state so far has been fully vaccinated. And you can see here on the map that, you know, a lot of counties, and particularly looking around the Houston area where I know a lot of folks are, it's, you know, they're lower percentages. They're about statewide average, you know, a little bit less, maybe slightly a little bit more. There are actually a few, just a handful of counties that have just done really, really fantastic. When you look out sort of near El Paso, there's a few down in the Rio Grande Valley, a few up in that northwest Texas, sort of west of Fort Worth. But if you look at these counties, you'll also notice that they are have a smaller population density. So perhaps that they've been able to be more effective and efficient at vaccinating their population. Whereas the major cities, you know, Houston, Dallas, Fort Worth, Austin, they have not really exceeded statewide averages. San Antonio has a little bit, and El Paso has done pretty good as well, which they are pretty historically good at doing immunizations in El Paso. And so kudos to them for keeping that up with COVID-19 vaccines. I wanted to break it down a little bit for folks in the greater Houston region who might be curious, how are we doing percentage-wise? And so if you look in Harris County, remember statewide average is about 11%. Harris County is a little bit under that, 10.2% of the residents are fully vaccinated. Next door in Chambers County across Galveston Bay, a little bit worse, about 8.9% of their residents are vaccinated. South of Houston, south of Harris County, they're doing better. So Brazoria County has 12.4% of the residents fully vaccinated. Galveston County has 15.2% of their residents fully vaccinated, which is one of the highest in the greater Houston region. And then the other one that is also the highest in the greater Houston region, looking at Fort Bend County at 15.4% residents fully vaccinated, but then it really starts dropping off around sort of northwest Houston. You look at Waller County, only 7.7% residents vaccinated. Montgomery County, 9.8% vaccinated. And Liberty County to the northeast, only 5.8% of the residents are fully vaccinated. And so most of the counties around greater Houston have not yet hit that state average of a little bit over 11%, excepting for just a handful. And so we definitely could see some improvements for sure, but also, you know, this is a very population dense area. And so even though, and so we have been getting a lot of supplies into the area, vaccine supply, but we also have so many more people to vaccinate as well. And so, and I'll probably talk about this a little bit later, but I can talk about it now. Is there are serious issues about health equity and access to the vaccines. And so, you may look at a map and say, oh, well, look, you know, greater Houston area has received so many vaccines. They have a ton of vaccine hubs, you know, Texas Medical Center institutions, very well resourced, even the Harris County Health Department, Houston Health Department, very well resourced, but that we still have a lot of socially vulnerable individuals in the greater Houston area that they may have been eligible under phase 1A or phase 1B, earlier phases, and they just didn't, because of health equity issues, because of underlying social determinants of health issues, have not been able to access the vaccine yet. And so it's critical that as we open up more, we open up the eligibility to basically everyone, that we don't leave those folks behind, those vulnerable folks behind. Okay, so one of the things that I wanted to talk about are kind of recommendations, things to do. And so I chair the Pandemic Vaccine Task Force, where it's you know, vaccine experts from across the state convened together, and we made some recommendations that we sent to the state, to the governor, to the Department of State Health Services about ways we thought could improve the COVID-19 vaccine rollout. And so I'll mention a few of those. One of the four main areas that we talked about were ways that we could support our COVID-19 vaccine providers. And the number one recommendation we had is really about ImmTrac, which is our state immunization registry. If you may not know, we're only one of a couple of states that has what we call an opt-in registry. The standard registry for nearly every state and US territory is an opt-out registry, where everyone's just included, but if you don't want to be included, then you can say, take me out. Texas, when we started our registry in 1999 through legislation, we were originally supposed to be one of the standard opt-out registries, but there was a floor amendment at the last minute that changed it to an opt-out, and that's where we have been for all these years. And one of the problems with that is that because of how it's been set up, it never really had sort of the capacity and functionality to be able to deal with all 29 million Texans and all of their data. And now, because of the pandemic, and the law says that if there's a public health emergency, any vaccines or other, you know, medical countermeasures that are distributed, they have to be recorded into ImmTrac, into the registry, so we can track these things. And so now everyone's forced to use the registry just for COVID-19 vaccines, but it really didn't meet sort of the CDC national standards for immunization registry and interoperabilities and things like that. And so our top recommendation is to really improve that functionality and interoperability of ImmTrac 2. And we have that through some legislation we've got going through the Capitol right now, but that I'll talk about in a minute. Another one of our recommendations was to really make plans outside of the hubs that we put out. I think maybe that was about in February or so, where we kind of, or maybe it was January, moved to this hub model from our original model of the sending vaccines out to all the providers who had signed up. To really include, expand beyond that into multi-specialty group providers and others that had that capability, so that we could reach more folks. And another one, and this is one that had been an issue raised early on, was making sure that providers had more options for people to access ways to register for a vaccine. I'm sure everyone has stories about, you know, wait lists, you know, websites that crashed, that were only available for a very short time. There were no wait lists at first, and so people, was just kind of luck of the draw if you were able to get in. You know, same thing for phone numbers that were set up. It was just really frustrating, and so that was one of our recommendations. And like I said, I'm glad that they've got this statewide vaccine appointment finder that they hopefully will be rolling out soon. Another one of the 4 main issues that we had for recommendations was about ensuring health equity. You know, there are about 165 different languages spoken in the state of Texas. We have an extremely diverse population. Heck, just within the city of Houston, we have an extremely diverse population. And so it's really important, if we're going to really reach all communities, that the vaccine information is culturally appropriate and provided in multiple languages. You know, in standard in Texas, a lot of times we do English, and hopefully that we're also doing Spanish, but there are many other languages that definitely we need to make sure that information is getting translated into. Another one of the recommendations was to try and implement the CCVI, the COVID-19 Community Vulnerability Index, which that incorporates the CDC Social Vulnerability Index along with the sort of health risk factors related to the coronavirus, so that we can sort of target zip codes really based on risk as we were distributing vaccine. You know, so far up to this point, vaccine distribution has been done solely based on population, so not based on any other kind of risk factors. And so in a sense, it's equitable to you know, send it out by population, but also as we're continuing the process and we're really trying to target underserved areas, it's important to know where those underserved areas are, so that then we can focus our efforts and send vaccine there. And one of the other recommendations is that really working aggressively to coordinate funding for programs that can help reduce health disparities in immunizations, as that was already an issue and we're continuing to see it with COVID-19 vaccines. Our third set of recommendations revolved around decreasing the impact on our highest risk Texans. And you know, one of the things that was really important to the members of our task force is, even as we get more supply and we expanded out to eligibility, that we're not leaving those high risk phase 1A and phase 1B Texans behind, that we're actually doing some work to sort of locate them and make sure that they can get in to get their vaccines. Another one, again, is trying to increase max vaccination opportunities outside of the hub system as supplies increase. We're looking even at sort of, you know, mobile units, ways that we can get out in the community. Even walk-up opportunities are something that would be very welcome in a lot of communities across the state. And then our third recommendation under here was, while we were in that phase 1 and phase 1A and phase 1B, if once we get additional supply, that family members should also be considered high priority, which, you know, I come from the public health preparedness world, and that's something that we do sort of with, you know, like a medical reserve corps pod distributions, is sort of you protect the family unit, and so everyone gets it at the same time. I'll tell you that, you know, this recommendation, now that they've opened it up to everyone, you know, that's great. That's definitely, family members are going to be included. And then our last set of recommendations was about transparency. I mean, when you're talking about vaccine hesitancy and really trying to build and increase trust in vaccines and the vaccine development process, transparency is the name of the game. And, you know, what we have in Texas to develop what are those high risk groups, we call it our COVID-19 Expert Vaccine Allocation Panel, or the EVAP. And, you know, at the federal, so, and this is sort of the legal part, but, you know, at the federal level, what they're doing is they're making guidelines and guidance and recommendations, but really the laws of public health are made most substantially at the state level. And so the CDC, their ACIP, the Advisory Committee on Immunization Practices, they've come out with their recommendations for high risk groups, but the states actually have to decide on their own whether they're going to adopt those or to make their own priority groups, which which they do. And in Texas, well, I'll say, you know, at the federal level, they've been really good about being transparent. They hold public meetings. I myself have spoken and given testimony at 2 of the ACIP meetings where they're developing recommendations for these high-risk groups. But in Texas, our expert vaccine allocation panel is made up of folks put on there by the governor. There's you know, folks that work in the executive branch. There's some legislators on the panel, but it is completely secret. They do not hold public hearings, and we don't really know what's going on in their deliberations and how they're choosing folks. And that's why our recommendation was to really hold public meetings and accept public testimony so that people felt comfortable in knowing how these risk groups were being chosen and why some people were being left out and some people were being included. Another important thing for us, you know, there was a lot of talk about possibly modifying the original EUA dosing regimens to maybe sort of stretch the vaccine, so maybe space the doses further apart, or, you know, other people have talked about even lessening the dose, but the task force definitely thought that it was critical for transparency reasons and trust reasons too, to make sure that we adhere to those original FDA EUA emergency use authorization dosing regimens. And then finally, you know, it's critical that we collaborate with trusted community partners so that we can amplify clear, consistent, and customized public health messages to ensure that all Texans, all 29 million of us, really understand the importance of receiving our COVID-19 vaccines. So, as I am getting into the last section of my talk, talking about action steps, because I know that that's something that you know, you wanted to discuss, like what can we do to help improve the process and things that are going on. So number 1 action step for you that you can do tomorrow morning, pick up the telephone. So we have 2 bills, one in the House and one in the Senate, and that is our immunization ImmTrac bill to improve the system so that we have a nice, robust immunization registry system. So my first ask is, you know, pick up the phone, call the House Committee on Public Health and say, you know, please set a hearing next week for House Bill 325. It's an important COVID-19 immunization registry bill. And then, you know, pick up the phone again and call the Senate Committee on Health and Human Services and say, please set a hearing next week for Senate Bill 468. It's an important COVID-19 immunization registry bill. We need to get those bills, particularly that House bill, a hearing next week, because if we don't get it a hearing soon, then we have run out of time in the Texas legislature, because they are on a very tight time schedule. And if we don't get it next week, then this critical piece of legislation may not see the light of day. And it is, we've needed this for a long time, and the pandemic has really amplified the need for getting that registry fixed. And then the other action I would ask of you is you can send an email. So I would, you know, email members of the Texas Senate Committee on Health and Human Services. The link to the committee members are there where you can access their email addresses, and say, please vote Senate Bill 239 out of committee. It's an important COVID-19 bill to disseminate critical information about immunizations during a disaster. Again, I was up in Austin yesterday morning, I was invited testimony in front of the Texas Senate Committee on Health and Human Services, testifying in favor of this bill. It's really important, and it's great that it got a hearing, and now we really need folks to call in or email. You can just email in and say, hey, pass this bill, so we can get it out and start making a difference. And then the last thing that I would say, I am not going to go through all of these, I promise, but just for your edification, you know, follow your bills, look at what's going on with immunization legislation, and tracking it as it's going through committee. Bills that you're particularly passionate about, call your legislators, call the committee, email them, let them know, hey, I'm a doctor for change, and this is critical that we get this done. And so, here's a few bills I mentioned already: the ImmTrac Opt-Out bill, House Bill 325 and 460, Senate Bill 468. We got to get a hearing on that next week. Senate Bill 239 that had a hearing this week that I testified at, but it's got to get voted out of committee. Another one of our pieces of legislation that I drafted up is Senate Bill 1353 by Senator Miles. And this one is really about health equity. It's about getting good demographic data on our immunizations so that we can find out if there are, we can really get the data about the health equity issues for immunizations so that we can better target our services. And then there's also Senate Bill 636 by Senator Seliger that we call the Parents' Right to Know bill, but it's about transparency and making available the public health data about immunization rates by individual schools. And so I'll give an example. We might have at Houston ISD an overall school district non-medical exemption rate. Well, that's one of the largest school districts in the country. There's over 300 different campuses. It doesn't really help an individual parent to know, this overall rate. And so just getting that data out there. And, on the slides, I've got tons of other immunization bills on here that you may be interested in. But like I said, I won't read through all of them, but we have so many interesting immunization bills. But that's the thing, is that we can file good immunization bills that really would, make an impact. But unless they actually get hearings, unless they get passed out of committee, unless they get passed on the floor, nothing's changing in Texas. And we really, really have to get our immunization rates up, not only for our regular immunizations, but as I mentioned, with our COVID-19 vaccine, the experts are saying, we got to have really, really high rates. And so that is my summary. I love this image, reminding folks we really are working to protect all 29 million Texans from vaccine preventable diseases, and really appreciate you guys taking the time to hear some COVID-19 vaccine updates. And you're always free to contact me if you have any questions or ideas about immunization policy or activity. So thank you so much.
Thank you, Allison. That was incredibly interesting and useful information. For those that are on the webinar, I'm going to ask that you have a question box. If you have specific questions, to go ahead and type those into the box now. So the first thing I'm going to do is take facilitator privilege and ask a few questions of my own while we wait to see if others have something that they'd like to ask. So you mentioned the state appointment tool now that's going to be rolled out. I heard this morning on the radio, someone from Harris County was talking about how they were going to continue to use their own appointment tool and not participate. So what is it that your recommendation would be? Because I think that's still going to be confusing for people to say, well, if I'm in Harris County, where do I make an appointment? Do I go to the state appointment finder, or do I go to Harris County? Our county is going to be asked to participate in some way. Is there some interoperability? We want to make sure we're getting the right information out.
Yeah, that is a fantastic question. And I'll tell you that it's still going to be well confusing. Jurisdictions like Harris County that have really robust registration systems, they are not the ones that are in need of help from sort of a statewide system. It's really those smaller jurisdictions that just didn't have the ability to set up these systems. And so it's a help for them, But for the question about interoperability, frankly, we don't know, and in no way folk like should organizations like Harris County Public Health, who have really great systems, need to downgrade if the state system isn't quite as good. And so yeah, it is, I would say, an improvement in areas where they do not already have robust systems, but it's definitely probably too late for many places that already do. And I know that folks will, there will continue to be confusion, but at the very least, my hope is that the folks that really don't have any kind of access to a waiting list or information, at least this state page should hopefully point them in the right direction.
Okay, thank you. So you're talking about creating demand, and obviously transparency is such an important part of that. I think one of the challenges that I've seen is information that's coming out through the media and how confusing it can be. So, in an attempt to be transparent, I think that we've created a situation, for example, where there might be some confusion over efficacy rates, and people not wanting a certain vaccine because they don't think is as effective as another option. Or we have, for example, religious groups coming out against a particular vaccine because of the way it was developed using fetal tissue or fetal cells. How do we overcome that particular confusion and barrier? I mean, I don't expect you to know the answer off the top of your head, but if you have suggestions, I think that many of our members as providers would love to be able to talk to patients in a clinical setting who may bring up that concern.
Yeah, absolutely. And that's one of the issues that we have, with media that they tackle all the time, even outside of healthcare issues. It's trying to explain a complex issue into a simple way. And so talking about the efficacy thing. So yeah, it's true. You're looking at the numbers, Pfizer, Moderna vaccines, they seem, that they have a higher effectiveness rate. I mean, you can just see the numbers. But what is sort of the extra bit that needs to be explained is that also it's a little bit like comparing apples and oranges, because the Pfizer and Moderna vaccines, those are mRNA vaccines, and they really shot right out of the paddock really quickly. And so they were able to be tested in their clinical trials earlier on, where we really didn't have all of these sort of mutated versions out in the community yet. The Johnson & Johnson Janssen vaccine, it comes along a little bit later. They are testing where there are these variants of the vaccine, and that it originally wasn't, particularly matched up for. And so their clinical trials are a little bit tougher. I mean, you look, they actually did clinical trials in South Africa, where we know there was a especially virulent South African strain that they were dealing with. And so what the most important thing, and so if you're sort of media, you're kind of boiling it down, the most important thing is looking at how effective are they against the most serious consequences of COVID-19, against death, against hospitalization and ICU. Well, on that measure, they are all very extremely effective. And heck, now if we had those Pfizer and Moderna vaccines out with all of these variants going around, their effectiveness numbers might look similar to Johnson & Johnson. We just don't know, because the time period was a little bit different. It's the same thing. You talk about religious issues, and one of the ones I've given several interviews about are with the Catholic Church, and kind of messages coming out of the Vatican, messages coming from the U.S. Conference of Bishops. Well, the messages coming out of both of those have been really clear and consistent. But what we're seeing on the local level are parishioners and even some of the parishes themselves not taking in sort of the full message. And so the message is this, which is pretty clear. It says, you know, the Catholic Church opposes any kind of medical research or therapies or vaccines that utilize fetal tissue in any way. That's something that they've been opposed to, and they claim that's, you know, morally wrong. But what they also say is that it's really important to get vaccinated, and that there is there's a degree of separation between some of these vaccines and that original fetal tissue that they consider to be acceptable. So those mRNA vaccines, they may have used that fetal cell line from 1985 in some of the testing, but it has not been used in the development or in the vaccine itself. And so that is, they said, you know, perfectly acceptable. You do not have to worry about your morals getting that vaccine. With the Johnson & Johnson Janssen vaccine, those fetal cell lines were used in the development. They were used in the testing and were used in the production of the vaccines. Although again, no fetal cells or fetal cell line material is actually in the vaccine itself. And that one, what they said is this: if you have a choice, if you're offered a choice between Johnson & Johnson or one of the mRNA vaccines, the church would like you to get the mRNA vaccine. But if you don't have a choice and the only vaccine available to you is one that was developed or used fetal cell lines in some way, that it is okay to take it. And because that's how critical it is to make sure that the entire globe gets vaccinated and protected and healthy to get out of this pandemic. And so it took me a couple of minutes to summarize that, right? And so that would be, and like I said, I've given media interviews on this, and it's not a great, you know, media clip to sort of get into the nitty gritty, but the bottom line is that, you know, if you don't have a choice, it's morally acceptable to the Catholic Church to take whatever vaccine is offered to you. And if you do have a choice, the mRNA vaccines are considered more acceptable to the church.
Thank you. You synthesized that much better than my parish priest did last Sunday. I don't see any other questions in the chat box, so now I'm going to move a little bit to the zip code issue. I think it's great, and I know that in Harris County, the last couple of times they've tried to prioritize the wait list for appointments based on zip code where there's the most need, and also to try to create some equity. There are some challenges with that though, because these are also places where people might have internet connectivity issues, or they may not be able to access and sign up for these lists. Has your organization or anybody on the task force have any recommendations for how we might address some of these other barriers, you know, simply just signing up to get an appointment?
Yeah, you bring up a really excellent point. We have talked about that on the Pandemic Vaccine Task Force, and I'll also say that my organization has a Health Equity Council for Immunizations that is made up of another group of folks from around the state that's really focused on health equity issues. And that's something that we discuss all the time. I'll throw in one other issue that we've talked about in those meetings is, you know, and I can give, you know, Houston as an example. We have so many healthcare settings where a person can go and get vaccinated. We even have the ability to do some mobile clinics, but there are definitely areas, in particular, you think of areas where there's a high immigrant population, where there's a comfort level or a discomfort level about, even if they had access, internet access or phone access, about signing up on a list and putting their name on sort of a government document, because maybe they have, you know, immigration issues that they don't want to, you know, contend with, or even just traveling outside of their neighborhood is a dangerous proposition for them. And so that's the thing that we're really talking about, is that, you know, we need to go to where the vulnerable populations are and meet them using the communication tools and the interactions that are comfortable to them. And so if it's areas we know that have low broadband access, cell phone usage, things like that, it may be that we need to do kind of the door-to-door flyer type of thing that says, hey, we're having a mobile clinic that's coming next week. You don't even have to sign up. You can just show up and get vaccinated. No paperwork, you know, all of these things that we know are barriers. One of the things that we've heard from communities across the state is they're worried just about filling out forms. The more questions that are being asked, the more concerned they are about perhaps themselves or a loved one getting arrested or detained for immigration issues. And so that's something that we need to make very clear, that our priority is keeping people healthy and protected from disease and making sure they're getting vaccinated, and that there shouldn't be that kind of fear that people would naturally have about sort of you know, utilizing services and healthcare services.
Okay, excellent. And now we have had some questions come through. So the first one is, do you have a sense that the COVID-19 vaccine will be required for healthcare professionals the same way that hospitals require the annual flu vaccine?
Excellent question. And so the point I would like to make, that in Texas, there's not a statewide requirement for healthcare providers to have the flu vaccine or other vaccines. That is made on an institution by institution basis, clinic by clinic basis, hospital by hospital basis. So most hospitals, really nationwide, make it a requirement of employment to get vaccinated for the flu. Once, and this is what I advise hospitals too, once we move out of the emergency use authorization phase, the EUA phase, and we get kind of that gold seal, blue ribbon, gold stamp of approval on these vaccines, because we've had longer periods of data that we can analyze, that yes, these are definitely safe and effective. We're out of this sort of emergency review. Then they'll be in the same category as all of the other vaccines that we have that are approved. And you know, and this is under employment law, but a hospital could, as a condition of employment, require people to be vaccinated against COVID-19. I don't recommend it while they're just EUA vaccines, but once they have gotten that regular vaccine, the true FDA approval instead of just authorization, I would not be surprised to see healthcare facilities, long-term care facilities incorporate it just like they do with the flu vaccine and make it a condition of employment.
Okay. We know there's some hesitancy and some questions about the COVID-19 vaccine. Have you seen a lot of anti-vaccination energy around, you know, people just outright discouraging others from getting vaccinated?
Oh yeah, most definitely, most definitely. We've seen it all over the country. I'll tell you that, you know, the anti-vaccine movement during the pandemic, they have really buddied up with the anti-mask folks as well, sort of the anti-government folks. And so they've actually kind of grown their coalition, their anti-coalition, I guess you could call it, and have actually been very active in trying to discourage vaccinations. Very famously in the news, they had a mega vaccine site at Dodger Stadium in Los Angeles, and thousands of people were there in line to get vaccines. Well, the anti-vaccine community, they organized on Facebook and they did all these protests, and it was so disruptive and possibly dangerous that they actually had to shut the vaccine site down because the anti-vaccine people were yelling in the people's faces, you know, about how terrible it was to get vaccinated. And so there have been definitely some ugly altercations, and in general, I mean, the hesitancy for COVID-19 vaccines is high. Higher than it is for other vaccines, because people do have a lot of concerns or questions. I mean, vaccine hesitancy is more questioning. It's not necessarily anti-vaccine, but the anti-vaccine folks are really preying on those questions and hesitancy and really trying to turn folks off of the COVID-19 vaccine, which is so dangerous. I mean, we know, we've seen the numbers already. It's deadly to do so. And also, I mean, vaccines make Texas work. And so, you know, when we're vaccinated, we're healthy, we're back at work, we're back at school, our economy's going. I mean, we don't want to stay in this pandemic world any longer than we have to.
Mm-hmm. And you know, are there additional concerns around pediatric immunizations? I mean, I know that some of the vaccines are now doing clinical trials on children under 12 and under, but has that come up in conversation from a policy level about how that would be rolled out in the future?
Yeah, so I mean, once we get emergency use authorization for the pediatric vaccines, I do expect a whole nother wave of concerns for parents. You know, every parent wants to do what's best for their children, and so I think that it's going to be critical once we do get some data on these pediatric vaccine clinical trials, that we have really solid data that is understandable to parents so that they feel comfortable if something is authorized for emergency use, that they are doing the right thing and it's safe to give their child a vaccine. Because as I mentioned, parents do want to do what's best for their children, and hopefully we will get some data out that shows that it is going to be best to get the children vaccinated against COVID-19, get those kids back in school, back playing sports, back where they want to be. But yeah, that is definitely a concern once we get the pediatric data back, that we have some, I'm hopefully have some really good, strong quality candidates for that.
Excellent. So given the fact that we're going to have it hopefully available for pediatric vaccinations, we know that even just for regular childhood vaccinations, there are ways to get exemptions. Do you think that this is going to be part of the required vaccinations for school, or will this be one that's optional?
Oh, great question. One I get asked all the time, even very early in the pandemic, and sometimes I had to say, we don't even have pediatric vaccines yet, but we will, and I'll tell you that this is the answer for that. So same thing I talked about with hospitals and the employment qualifications for employment. School vaccinations are laws that come from the state. The CDC's ACIP makes the recommendations for what vaccines people should get, and then the states themselves incorporate into law what they're going to do. So in Texas, we mostly have incorporated the ACIP recommendations into law, except for notably, it is not required to get an HPV vaccine for students in Texas, and it's not required to get a flu vaccine for students in Texas. Two outliers. Once way down the line, if we finally get a fully FDA approved COVID-19 vaccine for children, for pediatrics, we'll also have to figure out at that time if it's a one-time vaccine, if it's a booster type of vaccine, kind of depending upon the variants and things like that. Is it going to look more like a flu vaccine, or is it going to look, you know, more like a TB in terms of frequency? So my answer is, it could be a requirement for schools in Texas once it is fully approved by the FDA, but we already know that there's at least 2 vaccines that are recommended by ACIP that Texas doesn't require for schools. And so that will be a political question, frankly, whether the public feels like it should be, because if they're that they don't think it should be a requirement for school, the legislators, they're going to listen to that, and it wouldn't also surprise me if they prohibited it from being a required vaccine in the state as well.
Okay, so just very quickly back to this equity issue. You know, in terms of the allocation, we know that a lot of institutions in Houston specifically received the doses of vaccine, you know, from the center. And they seem to have received a lot more than the local health department. Is there, you know, I know at first it was because they had the facilities to roll things out, but moving forward, is there any sense that that distribution is going to be more equitable so that some of those zip codes that we mentioned do have better access?
I certainly hope so. I really do. I know, you know, the state of Texas and all states are responsible for their own to get that supply from the federal government. And so, you know, we've heard from the state, you know, we just don't have enough to get out to everyone. But now that in the near future, that won't be a problem, I really sincerely hope that we aren't hearing of these inequitable distributions anymore, because that's something that I think does need to be addressed in the places that have been overlooked or haven't received the vaccine allotment that they've asked for the residents that they have. You know, we need to make sure that those discrepancies are made up and everything's evened out.
Excellent, thank you. So these wait lists that we have and these registrations, do you think once we have supply, those will be, you know, those will become obsolete, that we'll have enough to meet the demand?
Yeah, I mean, hopefully we will definitely have enough to meet the demand. My hope is that, you know, the wait lists get emptied out really soon, and that we then have to start knocking on doors and looking for folks to be like, have you gotten vaccinated yet? Because I have an opportunity for you. We can get you in this week if you would like to do that. We are seeing in some places the wait lists are being cleared out, but they shouldn't be. There is the demand for a lot of in a lot of places and with some certain demographics in the state is not where it should be. And you know, we talked about some hesitancy issues with communities of color and trust in the government and historic injustices from the government and from the medical institutions on communities of color, that they're, you know, well-founded hesitancy about getting the vaccines. But we've also seen in polling, you break it down, political divides as well. You know, some of the most recent data said that I think it's white Republican men are some of the least likely to want to get vaccinated in the state of Texas. And so we have all sorts of groups and micro reasons why we have the hesitancy or lack of demand, and that really has to be addressed now, because the supply is going to be here soon, and we need to make sure that all 29 million Texans are you know, rolling up their sleeves to get their vaccine.
Okay. Well, thank you. I'm not seeing any other questions, and I do apologize to participants. I seem to have a technical glitch on my side. I'm just going to ask Jorge, who's been in the background, have you seen any other questions come through? I want to make sure we get to everyone's.
Hello. So let me see. I have a question here from Anna, and she is with Houston in Action, and she has a couple of questions.
I did get to those.
You got to those? Okay, so those were the last ones, and so
Yep.
my apologies. I know she had a couple of questions, so I wasn't sure if we covered them all, but that should be all the questions. Thank you so much.
All right. Thank you so much. And I apologize to participants if we didn't see the questions come through. Thank you, Allison, for your time this evening. This has been very illuminating. It's clear that there are a lot of, possible next steps that Doctors for Change can take. There's still so much work to be done. I hope now that that we're opening up eligibility, that everyone who's on this call who hasn't gotten their vaccine gets on those appointment lists as soon as possible. I'm excited. I get my second dose tomorrow. And that, we'll follow up with the slides that you shared about the advocacy. We'll put out a call to action so we can get those bills into committee and make sure that our members are doing their part to send those emails. And please call on us if you need a provider to testify at any point in time. If those bills do get to hearing, we're happy to help and lend our name to support those things. And thank you to those of you that joined us on our webinar. This will be recorded and edited so that you can enjoy it after the fact and share it with your colleagues. And we look forward to working with you and seeing you again soon. Thank you, Allison.
Thank you so much. I really appreciated the opportunity to speak with you guys tonight.
Thank you.